For patients experiencing a behavioral health emergency, thoughts of suicide, violence, substance use, anxiety, we're spending long periods of time in the emergency department just waiting to see the psychiatrist. And the longer patients spend in the emergency department before seeing a psychiatric specialist, often the worse their symptoms can become.
Patients would arrive to emergency departments and they would just kind of wait, and they would have to wait and wait and wait.
For many of these patients and their families, this is the worst day of their lives, the worst night of their lives. They're in a tremendous crisis.
Certainly when someone spends time waiting and they don't know when they're going to have an answer, it increases anxiety, frustration. So to be able to connect them to care immediately is definitely the right thing for our patients.
The goal of the Northwell telepsychiatry program is simple. It's that no patient experiencing a behavioral health emergency should have to wait to be seen in an emergency department, that they should be seen promptly in whatever emergency department they've come into.
Hi Daniel, my name is Dr. Merson. How are you?
Good. Hello.
Through two-way video, our clinicians are able to help patients experiencing a behavioral health crisis, regardless of their location.
It really is a way to connect our patients to the care they came in for.
We are treating patients of all ages, from 4-year-olds to 104-year-olds.
It's not just our psychiatrists, it's a robust team on both sides who are working diligently to, as a plan of care for the patient. Upon their arrival to the emergency department, we basically lay out, hey, here's a cascade of events that are going to occur.
About 40% of the patients do end up needing admission to a locked psychiatric unit, and the team here also facilitates that admission, obtaining a bed, ensuring safe transportation, and in many cases actually functioning as the admitting psychiatrist, putting in inpatient orders and facilitating the legal paperwork. What differentiates our emergency telepsychiatry service from other telepsychiatry programs is that we have an on-site multidisciplinary team, and the multidisciplinary team consists of attending psychiatrists, social workers, mental health counselors. There's a real focus in our program on quality of the staff that we hire, quality of the care that we deliver.
This collaborative effort has significantly reduced the length of stay for patients.
Telepsychiatry has been an incredible tool for our staff.
Since telepsychiatry, we've cut that wait time by over 90%, such that most patients are seen within 30 to 45 minutes by the attending psychiatrist and their team.
It's very reassuring to the families as well that we can provide those services basically at the touch of a button.
So we've not only been able to improve our numbers from what we were doing before where it was provided, but we've actually been able to expand the care to areas where it wasn't even a service that we offered.
If you think of the benefits of that program, it's accessibility. It's having, a specialist on one site, but who covers a much larger footprint for our organization.
Who's going to want to do this? It's, maybe it's not comfortable. And we have been pleasantly surprised that all ages have welcomed this as a technology. I think when we've become much more used to interacting with people on our screens already at home and on our phones, that it makes it very easy to make the transition even in the healthcare space.
This technology has no boundaries. We truly believe that patients experiencing a behavioral health crisis should receive the same level of care regardless of their location, whether it's an urban setting or a rural setting, New York State, elsewhere in the United States or around the world. Everybody is entitled to the same level of care when they're experiencing a behavioral health crisis.